Hi, I'm Group 15. My name's Angela.
I'm Lauren. I'm Carol Lee.
I'm Chuck, and we'll be talking about health informatics in our video.
During this video, we will analyze what health informatics is by referencing Julianne Sweeney's article, in which she discusses the implications of new technologies that are introduced in the healthcare setting, whether they be critiques or appraisal. Additionally, we will discuss Tammy Lovell's article on incorporating apps with EHRs to track disease trends and progressions. Healthcare informatics is a collaboration between healthcare, computer, information, and cognitive sciences to organize and manage healthcare information. Related professions include informatics nurses, computer scientists, and statisticians. The goal of healthcare informatics is to enhance delivery of care, advance patient education, manage and communicate patient data, and overall improve health outcomes.
In terms of clinical implications surrounding informatics, various systems are used by healthcare members in a clinical setting. Some of the examples include electronic medical records, data collection devices such as vital sign machines, and emails. However, there is a gap between technology and process. Healthcare informaticists help bridge this gap. Skills are needed to understand data collection, storage, and extraction. President Obama signed the American Recovery and Reinvestment Act, which incentivized providers to use electronic health records. Providers who don't normally use electronic health records are behind a learning curve, and healthcare organizations now have to manage and analyze all the data stored by these records. There is a new need for professionals to collect, interpret, and study this data.
In terms of the managerial implications of healthcare informatics, it consists of interpreting information and modifying data to be utilized in decision-making process. As of 2019, managerial programs are often used in payroll function, streamlining material control, and assist with financial and administrative factors of the role that was previously done manually, which increases the efficiency and reduces the risk of information loss during the process. However, many people think that this technology should be used as a management tool by integrating the nurse manager, colleagues, and IT specialists together to identify issues related to patients and their recommendations for diagnostics, which improves documentation in the EHR for future reference. As a result, healthcare information system can ultimately enhance communication, time management, and the delivery of information among staff and patients.
The last example of emerging healthcare informatics implications is the policy implications. Policymakers can use data from electronic health records to make decisions about public health issues, but it is important that healthcare providers understand the large influx of data in the electronic health records. Therefore, guidelines were developed to help public health officials utilize data from electronic health records, patient portals, and other data sources. This is so they are able to thoroughly understand the data they are seeing in order to make sound judgments on new health laws. Their growing use of technology means that it is especially important that healthcare providers follow HIPAA guidelines. With the use of electronic health records and smartphone applications involving health, there is an increased liability for a breach of patient privacy, so ensuring policies are implemented as new technology is introduced is crucial. An example of integrating technology use into the electronic health record is Salford Royal Hospital. Salford Royal Hospital had 20 patients use an app developed by the University of Manchester's Connected Health team at the Center for Health Informatics to input their symptoms every day for 3 months. The data that was collected was integrated into electronic health records and put into a graph visible for outpatient visits. The app was able to find flares and long-term trends in symptoms that may have been missed without the app. The app was especially helpful for patients who had difficulty recalling their symptoms, and it improved face-to-face consultations, as the normally short consultation times could be used more efficiently with the patient's personal data. This app is proof that technology used for daily remote monitoring can benefit both doctors and patients.
Thank you for listening to us, and if you really like this video, tune in next week for more.